Dell, and I'm with the California Foundation for Independent Living Centers. You're joining us today for our second part in our in-home supportive services advocacy and organizing series. Today's topic is identifying our issues and organizing for change. Before we get started, I'm just going to give some tips to orient you to our Zoom platform. We are presenting on Zoom webinar today, and we do have captions available. If you'd like to access them on Zoom, you can go to your Zoom toolbar and look for the CC closed caption button. If you don't see that, it might be nested under the More button, which are those three little dots. Go ahead and click that, and what you're looking for is the option that says Show Subtitle. We also have captions running on StreamText. I just shared the link to that in the chat. You can go to StreamText to follow along on a separate device or monitor, and you can also adjust your caption sizes there. So we suggest using that if you'd like to adjust the captions you're seeing. If you need any access support during this event, please feel free to use the chat on Zoom, or you can email me. My email is megan@cfilc.org, and I just went ahead and placed that in the chat as well. For today's webinar, chat is just going to be used for any technical assistance or access needs you might have. We ask that if you have any questions for us, that you please put them in the Q&A box, and that should be located on your Zoom toolbar. And if you're unable to locate the Q&A or you prefer to audibly ask us a question, we ask that you please raise your hand. And there's a few different ways you can do this depending on how you're joining us today. If you're calling in on the phone, you can dial *9 to raise your hand. If you're on Windows, you can go to the webinar control bar and look for raise hand, or you can select Alt-Y to raise your hand. If you're on a Mac, you can also go to the webinar control bar and look for that raise hand button, or you can select Option +Y. And finally, if you're joining us on Android or iOS, you can tap the raise hand button on your screen to lower and raise your hand. We will be doing a poll during this event. When we launch the poll, it will pop up on your screen, and we will be sure to read the questions out for access and give plenty of time for you to complete that poll. I'm going to go ahead and pass it over to Russell. Thank you for joining us.
Thank you, Megan. Good afternoon, everyone. My name is Russell Rawlings. I am the statewide community organizer at California Foundation for Independent Living Centers and the facilitator of the DOnetwork or Disability Organizing Network program. Welcome to our second installment in the IHSS Advocacy and Organizing series. Just as a quick outline, our goals for this series are to educate, mobilize, and empower. This is part of a four-part monthly series dedicated to positive systems change for California's IHSS system. We have our sessions every third Wednesday from 1:30 p.m. to 3 o'clock p.m. And on this slide is a link. The next session will be October 20th, 2021. The registration link is tinyurl, that's tinyurl.com/IHSS DOnetwork and the number 3. So that's tinyurl.com/IHSS DOnetwork 3. All right. I am really excited to be here with you all today. We're going to do something a little different than our last session, which was presentation heavy, and switch to more of a presenter style format. So a little bit more casual today, and also opportunity for you to get to know some of the folks that are working hard to make sure that we establish this process where we can all build together and push for positive change. So again, I want to welcome you all. I will be joined today by my co-MC, Nikki Brown Booker, who is the program officer of the Disability Inclusion Fund and is the co-chair of Hand in Hand Steering Committee and a long-term IHSS consumer. So I'm going to talk a bit about last month, we discussed the origins of IHSS and public authorities and how it took people coming together and organizing to create the largest consumer-directed home care program in the country. Today, we'll focus on the organizing that will be required to ensure that IHSS lives up to its original vision of supporting and empowering the community to bring about positive systems change that eliminates marginalization and allows people with disabilities to live their lives as they choose and thrive in their chosen communities. This is the founding principle of the independent living movement upon which our work is founded. So now I'm going to turn this over to introduce Ingracia Figueroa, who is a IHSS recipient and hand-in-hand member. Ingracia.
Thanks, Russell. Hi. The DOnetwork, California's Disability Organizing Network, is a program of California Foundation for Independent Living Centers, creating a statewide systems change network of disability rights advocates, activists, and organizers. California's 28 independent living centers each employs systems change advocates and community organizers that empower the community to bring about positive change that eliminate marginalization and empowers people with disabilities to live their complete lives as they choose to thrive in their chosen communities. This is the founding principle of the independent living movement upon which our work is founded. The DOnetwork celebrates the diversity within the disability community as we continue to build a culture of care for all people. Thank you.
Thank you, Ingracia. This is Nikki Brown Booker, and I want to introduce Monique Harris. Monique is a hand-in-hand member, leader, and has been an IHSS recipient since she was 16 years old. And I will pass it over to Monique. Monique, if you're talking, you are muted, so we might need to unmute you.
I'm sorry. Okay. And then it's over as you may of people who help and care workers and all care workers in our homes.
Hand in Hand is a membership organization made up of people who employ house cleaners, home care workers, and child care providers in our homes.
We work in partnership with the domestic workers to transform the domestic work into business workers and they employ us.
We work in partnership with domestic workers to transform the domestic work industry to benefit both workers and their employers.
We envision a world that values the domestic work and contributes to build just and secure economy.
We envision a world that values domestic work as fundamental to building a just and caring economy.
And will this children and celebrate for humanity and belong and we pay our foot dignity of significant injustice.
A world that celebrates every person's humanity and belonging and repairs our country's legacies of systemic injustice.
Will all people access for topic home care. We need to do whole life dignity.
A world where all people can access and afford the childcare and home care we need to live full lives with dignity.
And what we just put on 1 month and be a collective together. Thank you very much.
A world in which we depend on one another and build collective solutions together. Thank you very much.
Thank you, Monique. So now that we've heard today about the DOnetwork and Hand in Hand, the two partners that are coming together to build this process of organizing and develop this survey that you'll be hearing about shortly, I'd like to turn this over to my co-MC, Nikki Brown Booker, for an outline of our goals for today.
Thanks, Russell. So today we really are excited to talk about the IHSS survey that we are going to be distributing. The survey will help identify the biggest challenges facing IHSS consumers and providers and the best solutions and ask your help in distributing it. So we're defining consumers are people who actually use IHSS services, and providers are the people that provide the service to the IHSS consumers. We really want you to join in an effort to develop an IHSS consumer provider member-led network aimed at winning campaigns to improve IHSS so that IHSS consumers are receiving the supports they need to live with dignity, respect, and self-determination. And also that IHSS workers are paid a living wage and regarded also with respect and dignity. So I think, go ahead, Russell.
Oh, thank you. Thank you, Nikki. I wanted to turn this over to Sheila Gunn-Cushman for an opportunity for you all to be able to share some of your thoughts today. So Sheila is an IHSS consumer and a member of Hand in Hand and has been an advocate since 1993. Sheila?
And I've been an IHSS consumer since 1997. I just wanted to stop for a second, and just in case someone is so new to this that this is all Greek, IHSS providers, also known as workers, also known as caregivers, are the ones that are doing the work, and the recipients, consumers, clients are the folks that have the need and are receiving the services. And that may sound really stupid, but I can just see somebody going, wait, what? Okay, so I have the challenge and the pleasure of giving you a foretaste of the whole survey, because I'm going to ask you one question to start with that is going to start a 10-minute discussion where we get to figure some of this out and start to outline it. And that question is, if you could change one thing in the IHSS program that would make your experience better, either as a provider or a recipient, what would it be? And Russell and Megan, our tech wizard, will help with handling the Q and the Q&A.
Thanks. I'd also like to say that you may place your responses in the chat if you'd like, and I can read them aloud. Or if you choose, you may use the Q&A function or raise your hand if that is the most accessible feature for you.
Yeah, I'm sorry. I missed that.
We'll allow just a few moments.
This is Megan. Just a reminder to raise your hand if you're calling in on the phone. Dial *9. If you're on a Windows computer, it's Alt plus Y. A Mac, it's Option plus Y. An Android or iOS, you'll tap the raise hand button. And I see some comments in the chat. Emily Bridges says, oh, I'm sorry, it just scrolled away. Let me get back to it. Emily Bridges said, I'm sorry, Hannah says the single most important change is wages. Julie says, how about training? And Emily says, if I can get back to it, better coordination from all parties involved.
And by the way, we're archiving all this, so we'll add this into our little box of goodies as things go on.
This is Megan. I'm going to continue reading the chat. Shay says wages, and Constance says end of the marriage penalty.
Constance, that's something unique that most folks might not be familiar with. Do you want to mic up and maybe quickly go through what you're meaning by the end of the marriage penalty?
And Constance, I just allowed you to talk if you'd like to share.
Yeah, sure. Simply the fact that I'm considered an able and available spouse. Therefore, I'm supposed to do all the IHSS work that's considered housework, all the shopping, all the cooking, all the cleaning, all the laundry, all of that for free. I can't get hours like I could before we were married. I feel it very acutely because I'm in a same-sex relationship, and I used to get all those hours. Then one day the government handed me my rights to get married with one hand and took away most of my income with the other hand, and I'm still rather pissed about it.
Thanks, Connie. I think there's also some additional nuance for some folks, just very briefly, that have trouble continuing to qualify for Medi-Cal, maybe in situations where they are married, and that could be.
Yeah, that's entirely true. I can't do other work because I have to keep us poor enough that Jan can keep all her coverage, including her hours. It's ridiculous.
Thanks.
This is Megan. In the chat, we have a comment from Marissa. She says, an attendant backup system that actually works.
Notice there were a couple of mentions of wages. Is anyone here motivated to maybe speak a bit more about wages? Maybe someone who is a provider.
Thank you, Hannah. I'm going to go ahead and unmute you. Just one moment. There you go. Oh, I think I got the wrong Hannah. I'm sorry. Did I get the right?
I got it.
Yay, great.
So when I started doing IHSS work in 1981, I had to work about 40 hours a month in order to pay my rent. And now I would have to work about 80 hours a month, twice that. So even though my wages have gone up 5 times or so, my rent has gone up at least 10 times. Well, personally, it hasn't, but that's another story. Rents are now, easily $1,200 to $1,500 a month. And that means at $1,500 in many of the, excuse me, sorry, I was eating my lunch. Many of these counties in California, you would have to work 100 hours. So it definitely has not, the wages have definitely not kept up with the cost of inflation. And I'll just add too that, if people were paid more, they would be more inclined to stay on the job, and there wouldn't be as much turnover, and there wouldn't be all the time spent hiring and managing your workers if it was a more stable workforce, and you wouldn't have the problem of trying to find backup workers as much, because you would have more dependable people that were getting their needs met by having an adequate wage.
Some folks mentioned training. Would one of them like to step up and say what that might look like?
This is Megan. While we're waiting for someone to step up on training, Cindy shared in the chat, I think paramedical services should be paid more per hour because it's a trained service.
And what are paramedical services for those who don't know?
Cindy, would you like to share maybe a little bit more about what you mean by paramedical services?
Cindy, I just gave you access to your microphone.
Thank you very much. So that with the giving medication to someone or doing range of motion exercises kind of thing. It also be bowel and bladder care. Those are the only things that I know of, although I may be wrong about that.
Feeding tubes, nebulizer, breathing treatments.
Wound care also.
So
Yeah,
Sheila, maybe,
taking vitals and then having to make decisions on what to do next based on the vitals.
so Sheila, do we maybe want to move on to question number 2?
We can. I would just stick in about training that there are several ways of looking at training, and one of them is that workers might get paid to get training from their consumers about what they need, and or get training from the public authorities and get paid for it. So the second question, I hadn't looked at the time when we started, and I was going to give 10 minutes to that one. But the second one is, what would it look like? Hang on. What do you think it would take to get the one thing that you want put into the IHSS program, put there? The floor is yours. The chat is yours. The Q&A is yours. Raise your hand.
So does anyone have any idea what it would take to get your change made? Well,
Might we need to talk to the people at the county, like the boards of supervisors?
things are rolling in chat now.
Yes, this
Oh,
is
okay.
Megan. I was just going to read the chat.
Good.
And it says 400 billion in HCBS. Julie says advocacy, events, rallies, and speaking out. And Ingracia says massive community involvement statewide.
Mhm. How about letters to editors?
I agree. I'd like to maybe give Hannah an opportunity to speak about the 400 billion in HCBS. Not everyone here may know exactly what that is.
Mhm.
Well, it's part of the infrastructure bill to infuse the Medicaid programs, home and community-based service programs, such as IHSS, with $400 billion. That's a national, that would be covering the whole country. But I believe my impression of this survey and this work we're doing is in anticipation of an infusion of funds into the program, and for us to be prepared to make our demands as to what we as California stakeholders need and would rally for.
Thank you, Hannah. I see that Monique has her hand raised.
Let them stop working. Let them stop working. And let them have too much to get their paperwork together.
Monique, I'm going to need you to repeat that.
when home care workers want to work, they should give them 2 months to get together or tell them right away so they'll not wait that long.
If home care workers want to work, they need to give them 6 months to get it together. 3 months to get it together because we can't wait.
They can start right away,
They can start right away.
but they got 2 months to get all the paperwork together.
But they have 6 months to get all the paperwork together, like the background check and all the sign up stuff.
3 months.
3 months. I'm sorry. I keep doing that.
So Monique,
But what I heard you say, yeah.
oh, go ahead, Lindsay.
Well, what I heard you say, Monique, is that if a worker wants to work, they should be able to work right away and then be given the time to get the paperwork together.
Yeah.
This is Megan. We do have another comment in the chat from Constance, who says coalition building for changes in federal legislation. And then Ingracia just commented, stop the ridiculously long wait for new providers to get paid by IHSS.
That's good.
I think we need to bridge between unions and consumers, and that's going to take some doing, but I think it's important.
Thank you. I think all of our changes could use that, right? It's going to take a coalition.
So it's 1:58, and Russell, I don't know when you want to end this section. I didn't look at the beginning, so.
I think our input may have slowed down, so let's feel free to move on. Next, we're going to just give you an outline of exactly where we're at with this. Hand in hand and the DOnetwork have come together to develop a campaign that is led by IHSS consumers and providers. So we're looking to have all of you help us lead this.
And then we are we propose to start with a survey of IHSS consumers and providers to help us identify and prioritize the issues that we have with the IHSS systems and what solutions could be possible. Our goal is to use these issues to identify guideposts to determine our next actions.
We can only make real change if we come together across differences, whether that be one of type of disability, race, gender, age, or geography. This effort is committed to racial, gender, and disability justice.
And we are really trying to build a movement. So we seek to build a movement that unites IHSS consumers and providers around a shared vision of dignity.
There are still a lot of questions to figure out, and we don't have all the answers, but we invite anyone interested in being part of a collaborative and inclusive effort. And now I'd like to pass to Ligia Andrade Zuniga. She is a consumer and the chair of the San Mateo Public Authority Advisory Committee.
Thank you. Hola, my name is Ligia Andrade Zuniga, as Russell mentioned. So it's important that we identify issues that are very important to our community. So since we developed the survey for both consumers and providers, our goal is to have at least 400 responses by the 15th of November. I know it seems like a lot, right? It seems like, how am I going to get all these people together? But you'd be surprised how many people you know. So we're going to take a poll just to show you how many people you can actually reach. The poll will appear on your screen. And the questions are, how many IHSS consumers do you know? And also, how many IHSS providers do you know? So remember, there's two different definitions, consumers and providers. And that way you can see, how easy it could be for you to spread the word.
Probably.
So go ahead and fill out that poll, and we'll give you some time.
This is Megan. I was just going to read the poll question out for everyone. Number 1 is, how many IHSS consumers do you know? Include yourself if applicable. And the options are 1, 2 to 5, 5 to 10, or 10 or more. And the second question is, how many IHSS providers do you know? Include yourself if applicable. And again, the options here are 1, 2 to 5, 5 to 10, and 10 or more. And I am seeing a note that folks that I just allowed to talk are not able to take the poll. So let me see if I can get you guys on there. Let's see, I just removed permission to talk. So hopefully you guys will be able to see the poll. Thank you for flagging that, Lindsay. If not, we apologize. That is a Zoom error and glitch, and we'll get the poll questions to you based on the emails you registered with.
Yeah, we can't answer the question. We can't check on it.
We can't answer the questions.
Correct.
That's
Anyone
panel.
logged in as a panelist won't be able to answer the questions. And Russell, it looks like we have 17 of 27 attendees have answered.
Great. I'm seeing a few questions in the chat as well. I assume this means people outside. This means outside of people already on this call, for Constance. And sure, if you're able to measure that to some degree, that would be a good thing to use, I suppose. And Hannah says, I wasn't able to speak, but I still got the proper poll question. I'll give this
I figure the more the merrier. And if someone gets a duplication, everybody knows how to use their delete key, but rather send somebody something twice than that they don't get it at all. Because you don't know whoever told them, right? You just send it anyway.
Russell, this is
Thank
Megan.
you.
It looks like the poll has leveled out. We're sitting at 18 answers. Can I go ahead and end the poll?
Yes, we can go ahead and end the poll.
Great.
And
And I will share results and read them out for folks. So for how many IHSS consumers do you know? 0 people answered 1, which is a good thing. 2 to 5 people, 6 folks answered 2 to 5. 3 folks on this call answered 5 to 10. And then a good majority, half of us, 9 out of 18 answered 10 or more. And then for the second question on how many providers do you know? 2 folks on this call answered 1. Half of us, 9 out of 18, said 2 to 5 providers. 3 folks on the call said 5 to 10. And then 4 folks on the call said 10 or more. And I'm going to go ahead and stop that share now.
Yes, so as you can see, we have so many different connections, right, within our own networking community. So just, I'm encouraging, we encourage everyone to share the survey with as many people as possible, as many providers, as many caregivers. Share it far and wide with all of your social networks, any, social groups you're part of, anybody. It's important for us to be able to gather all of that information to further our work and know what's important for everyone. This is how we can build our movement. So it's very, very important. And so with that said, I'll turn it over to Russell, excuse me. And thank you everyone for participating in the poll.
Thank you, Lehia. All right, so I'd like to give you kind of a general timeline, draft of a timeline that we're that we are creating together. And again, we are looking to you all to be a part of this process. So we hope that that you're all really excited. But we are opening the survey as of today, so you'll be the first to be able to look at it, and we will be sharing the link with you momentarily. Our goal, again, remember, is that we would like 400 responses, and we'd like to see at least half from consumers and half from providers. And we are collecting until November 15th for the purposes of being able to share with you in the November meeting. But that doesn't mean that we stop collecting, right? We'll still continue to collect, and we will use this tool going forward until we've identified and solidified our issues. And we feel like this amount of data will give us the opportunity to do that. And so on our November 20th meeting, we will be presenting those results and working to do a landscape analysis of IHSS. So between now and then, we will be talking in depth about the IHSS program, looking at the budget, looking at what may be coming up next year, what things are already happening, and what are the opportunities and what are the threats based on the top issues identified. And then in January, we are really hoping to transition this entire discussion. We're looking to transition this entire discussion to an opportunity for you all to create this organized space. So together with us, we will be creating a space. We don't even know what it's called yet. Some people have thrown out some terms that I'm not going to share just yet, because I feel like we'll want to build this together. But the idea is to bring providers and consumers together in the same space. So those who receive care and those who provide care will be building this effort together. So in January, we'll start launching those meetings and holding them throughout the state. So we're really excited to build toward that with this entire process. So with that, I'm going to turn it back over to Sheila, and we've got a second group of questions. So, Sheila.
So this is an opportunity that we have now, and I'm learning through this work that a lot of people, there's a continuum of knowledge about the IHSS program, about the IHSS system. And this is a chance to especially reach out to folks who may not know much about the system at all, may be struggling, maybe not getting what they need, and maybe what they need is out there and they don't even know it. But this is also a way to find problems that people have been experiencing for decades and would like to change. So the first question is, what are you excited about this process? And again, you can put stuff in the Q&A, you can put stuff in the chat, you can raise your hand, and Megan and Russell will be looking out for folks. And the time is now 2:09 for timekeepers.
This is Megan. We have a few folks with their hands raised. I'm going to go ahead and allow you to talk, Yael.
Thank you very much. I appreciate that. I apologize. I had to step away for a couple of minutes, so I didn't get to make my comment about what I would change about IHSS. And I think something that is very important to change is to either eliminate time per task or to make time per task a more realistic a calculation of time, because I think that has a correlation to the difficulty that providers have. They're asked to do tasks in a time that is completely unrealistic. And what happens is that people then either don't get everything that is needed to be done, or providers provide services out of the kindness of their heart from their own time and without pay, because they don't want to leave people, because they care and they don't want to leave people in bad situations. But no one can do shopping in 1 hour in a week. It's just not realistic for an able-bodied person. It's not realistic in the context of IHSS. So I would definitely change that. That would be my one thing I would change, among a lot of other things, but that would be my priority. The other question I have is, can people who are not consumers or providers but work in the IHSS arena able to also do the survey?
Thank you for that question, Yael. The answer is yes, they can complete the survey. There is a question in the survey that asks folks to identify if they are a consumer, provider, or neither. So they are invited to take the survey if they'd like. We can reconvene, and we have not yet discussed exactly how we are discussing the priorities, other than that we know that when finalization is selected, that it will be led by those who are providers and consumers. However, feedback is always helpful, and I feel like I would encourage folks to take the survey, but more importantly, to share the survey too with the community.
Can I add something?
Go ahead.
I figure that there are family members that are not caregivers that might see, or close friends that might see situations that friends or family are in, that they're not getting what they need. I think that those people are people we want to hear from, even though they're not consumers or providers of in-home supportive services, that can that can shed some light perhaps on something that might not be spoken otherwise.
This is Megan. I was going to read a few comments in the chat, and then we have a few more hands raised we'll come to. Sasha in the chat says, providers and consumers coming together to make substantial change to IHSS so that it works for everyone. Kim says, I highly agree that with the IL, I believe the hourly task guidelines do not accurately assess an individual's needs. The time for task guidelines were more realistic. And then Trish says, or former providers or recipients who have experiential opinions to share. And then coming to hand raises, Warren, you've had your hand up. I'm going to go ahead and allow you to talk. Warren?
The Zoom webinar.
There he goes.
Hello?
Yeah, you're good.
Hi, guys. Can you hear me?
Yeah.
Okay, good. So what I'm excited about is the opportunity for partnershiping. I agree with the comments about consumers and providers coming together to solve problems. I think that the consumer movement and the union movement, we ought to find ways to come together and work together around that. I think also other organizations like SICA, which is an organization that represents the public authorities, ought to be a part of that conversation, as well as other interested groups. And I hope that as we partner, we do it in as broad as possible and invite as many interested folks from as many places as possible. So that would be my main thing, is that we want to solve problems as inclusively as we can. Thank you.
Thank you, Warren. And then Constance also has her hand raised. I'm going to go ahead and allow you to talk, Constance.
Yeah, I just wanted to say absolutely include unpaid caregivers or privately paid caregivers in who can make out the survey. You know, I've been in those roles a lot of times, and I probably know more people who've done that than people who outside of my union experience who are part of IHSS. That's in some ways very much an invisible workforce that doesn't get factored into all this, and I think that it's long past time that they were. And also on what excites me, the breadth that I see coming in this coalition, particularly CARA, which
California Association of Retired Americans.
Yeah, bringing in, it isn't so much their focus on aging issues as the fact that that organization is mostly run by retired union people, and not just from SEIU, but from labor across the board. And labor has not been historically particularly supportive of disability issues or knowledgeable about it. And this is one way to do something about that and build the coalition that way. And that excites me a lot.
I got to grin. I got to say I'm grinning.
This is Megan. We do have one question on the survey from Trish. If there is a neither choice, will there be a drop-down menu of possible categories?
Thank you,
No,
Trish.
there is. Oh, go ahead, Russell, I guess.
I was just, go ahead, Sheila. I was going to add maybe something that I just thought of an idea that could follow up. I'm really seeing a lot of interest. This is a great reason why we bring the community together, right? Is because we're a brain trust. We've been looking at this survey, but let me pass it over to Sheila, and then maybe I've got an idea, especially since there's so much interest in the neither choice.
The survey as it is has a neither choice, but there's not a way of defining the neither. However, there are questions near the end where they're open and you can kind of stick some stuff in there. So we can collect that data and we can make a space for it.
So two things then I think I would say is one, if now it sounds like there's a lot of energy around the neither choice. So maybe this category of providers or recipients who maybe don't fall in the category of actually active or currently providing the services, but very knowledgeable, we can see to help you become empowered to maybe organize a space where it's a third input into the process. And so I think we can totally envision what that looks like.
The other thing is that
the only other thing I wanted to conclude with is that we are going to actually see the survey very shortly. So we'll have an opportunity to talk a lot more shortly.
the other thing is that the HCBS stuff may help us widen this into a thing that can help everybody, those that are private pay and those that are on IHSS. And one question that I would have is what caused you to be off of IHSS, or what, and people could share as much as or little as they wanted, because those things might be things we want to know about, because that's what's happening to a lot of people now. The boomers are coming. So yeah.
September 15th, 2021, 1 of 5.
Warren, mute. Okay.
It looks like we've had a few things come in through chat.
Yes, I'm happy to read those, Russell. This is Megan again. So the first comment here, it says from Janet, SECA is a statewide organization of advisory committees and governing boards to public authorities. By law, they need to be at least 50% personal assistance users or past users. They are already a voice for consumers in many policy discussions at the state level. Lindsay, I apologize, that was an internal message about Monique's computer. And then Trish said, thank you.
And thank you, Janet, for providing us again with the reminder of SECA's place and role. SECA, just so everyone knows, SECA is a partner in this process as well. And Janet was one of our panelists on the first webinar.
So,
all right, Sheila, do we want to maybe move on to question number 2?
yes, let me look at it. What questions do you have about the survey or any of this? We've gotten some already, but we'll officially ask you now. So chat, Q&A, raise hand. You guys know the drill by now, I think.
let's narrow this just a tiny bit too, because we will have a final Q&A section. What questions might you have about the process? Putting this together, the timeline that I shared, or what happens next?
Oh, well, I have a question, even though I'm a panelist,
Right.
which is there are elephants in the living room about how people are making the IHS. Let me start over. There are elephants in the living room about people getting care and people giving care. And we've had to stretch the program in ways that it doesn't expect to go. And we've had to create our own workarounds, and there's talk of mutual aid. And there are things that are beyond the scope of the survey that I would like to somehow keep track of in a bike rack where we don't lose them, and where when we look at, what's up and coming at the state or whatever, we figure out ways to tie our stuff into things that are already happening. How do we do that?
Well, I think you've maybe identified one, which is creating the bike rack, right? I liked that you used the phrase bike rack. Parking lot is all too often what I hear in organizing.
No, I don't drive. We don't do that.
I get really frustrated by parking lot, because that two things come to mind in parking lots. One, driving, which I know nothing about, and two, that you're leaving the car, right? Like that you're just like, it's just going to sit there. So the vehicle is just probably going to sit in the lot. We all know that it doesn't leave the lot very often. So a bike rack, though, on the other hand, leads me to believe that, not only are we acknowledging the work and, the actual lifting of the bike into the bike rack, but also that we'll have to lift it out. So
I stole it. I don't remember where from, but it's not mine, but anyone's welcome to use it.
I think we may also have a hand.
Yes, this is Megan. Warren has his hand up, and you should already be unmuted, Warren. So go ahead, please.
No, I didn't hear his screen reader.
Warren is still muted.
You might have to actively unmute Warren, but you have access.
Hear me now?
Yes.
Yes.
Thank you.
Great. Okay, so I do have a process question towards the end of this process, around January or so, when we actually do get to a place of activism and solutions-based approach. How do we bring together the partnerships in a way that gets us to that point? Because the question, I guess the question I have is that right now, we're trying to figure out how to bring folks together. How do you envision that happening, Russell, in such a short of a time? How do we bring all the forces together in such a way that we can actually have the action force by January?
Can I start that, Russell, or do you want to go?
Sure, go for it, Sheila.
Well, first of all, I am absolutely counting on every one of you, and that includes panelists, because I didn't get to take the poll, but I know more than 10 consumers, and I probably know at least 5 providers. So that's something to start with. I'm counting on us as the mobilization force. We talked about a bike rack. This isn't one bus. This isn't even one bus route. This is like a whole bus system. So I'm counting on all of us to outreach to everybody that we think might want to be a stakeholder in this process. And I hate the word stakeholder. Most people use it and I just go, ugh. But we really need as many people. We need this army as big as we can make it and as broad as we can make it. So it's going to be up to us to do that. Each one of us only has so much bandwidth, and we're going to have to expand our bandwidth by expanding our numbers. And then Russell, I'm sure you've got more.
Not a whole lot. Thank you. I think the pitch was excellently timed. So one final thought too, I think to maybe Warren's thought, is that one of the things we'll need to do is identify who are the people who are already in place to do some of the advocacy work alongside us and with us. So that will also be a part of our process, and bringing established partners and organizations like SECA and others to the table and in this work, and the unions especially, will be vital part of the work. So even beyond those of us here in this space, there are other spaces that we definitely intersect with, and we want to be mindful that we want to connect with them in deep and meaningful ways as well.
I also want to make sure that there is, I don't know if the word is accountability, I don't know if the word is support, but some public authorities are a mess, some public authorities are doing very well, and the places where public authorities are a mess mean that people aren't getting what they need. Places where registries are good, people are getting what they need. Places where backups are good, people get what they need. But if they're not, they don't. And I want to make a robust network. And I don't know if that means kicking some out who aren't doing, or if they want to do, but they just don't have the bandwidth and they need aid. I think we need to figure out how to determine that. I don't even know where to begin. That's so overwhelming, but there it is.
Well, to that end, I have a lot to say. There are tools that we can use as organizers to really, I think, address and find out exactly where issues are and where they might be. So I certainly don't want to discourage anyone. I don't want to put anyone on kind of a alert that we're being aggressive toward them, because really, honestly, we're going to succeed far faster if we keep the people that are already in the work and find ways to bring them around to the ideas and changes that need to happen. So I don't think there are as many barriers maybe as we even perceive. It may just be the kind of the system itself needs a really good,
serious revamping
from our community.
It's 2:29, so I don't know when we want to do what.
Let's give ourselves a good half hour to look at the survey. And to aid us in doing that, I'm actually going to pass this over to Marissa. Marissa is a hand-in-hand leader and also an IHSS recipient. And Marissa, I will turn this over to you. Note that this will also be the time where I put the surveys themselves in the chat. And then I think it would be a good idea for, I'm happy to screen share my screen for those of you for whom that is accessible, and kind of read through the questions in the survey so that you can start to maybe kind of think about them.
Okay, to give a brief overview of this survey that we've been talking about, it's a series of 21 questions. Most of all are optional opportunities to do ranked choices of challenges and improvements that we would like to see, and recipient or people can remain anonymous and provide input. Participants are given a lot of space to express their challenges and innovative ideas for the IHSS program. In other words, part of the survey is where there'll be a question, but there's parts of the survey where you can give your own personal input. So it's not all like multiple choice. There's places where you can give your thoughts and comments. So and the survey right now is in English and Spanish, and I believe Russell's putting it in the chat. But the URL for the English survey is https://tinyurl.com/ that's a / IHSS survey EN for English. And then the Spanish survey link is https://tinyurl.com/ IHSS survey ES for Spanish. And our goal is to, like we've stated throughout this webinar, our goal is to reach 400 surveys by November 15th. And the breakdown that we'd like to see is 200 from consumers and 200 from providers. And this is just my own personal input. Maybe those that are active in SEIU, if you know other providers, or maybe you can talk to folks at SEIU to circulate the survey. Just a thought.
All right, thank you, Marissa. All right, next I'd like to screen share with you the survey. In just one moment while I get that set up.
This is Megan. While Russell's loading that, I'll just read out the chat. Lindsay said the survey looks great. Thanks for your work on this, Russell. And Constance agreed, definitely. And then for the readout of the URL, all backslashes should have been slashes, is what I'm reading. Thank you.
Oh, okay. Sorry about that.
That's okay. I myself mess up backslash and slash. So thank you for catching that, Sheila.
All right, so let's make sure this is working. Okay, is everyone able to see my screen?
This is Megan. Yes, we can see your screen, Russell.
Yes, okay, great. Okay, so this is the hand-in-hand and DOnetwork in-home supportive services consumer and provider survey. And I'd just like to note too that this is a survey that was put together by hand-in-hand and the DOnetwork. Hand-in-hand had actually begun this process originally, and the DOnetwork provided additional input and feedback on this survey. So we've put this together. It is not the final end-all, be-all of the only way that we will be analyzing our priorities, but it gives us a very good snapshot as to the first picture that we've had in quite some time of what the IHSS provider and recipient or consumer landscape looks like. So first is just a brief thank you. Thank you for being willing to participate in our in-home supportive services IHSS consumer and provider survey. This survey will help guide our organizing efforts as we work collectively to organize for positive change within the IHSS program statewide. Your personal and contact information is optional, but we encourage everyone to share your information. And then we begin with fields for name, email, phone number, and zip code. There are, next question is person's gender pronouns. The options there are she, her, he, him, they, them, or other. And then we have a question for choose one ethnic identity, Hispanic/Latino, or not Hispanic/Latino. Choose one or more racial identities, regardless of ethnicity: white, Asian, Black or African American, Native Hawaiian or Pacific Islander, American Indian or Alaska Native. And then question number 8. I am an IHSS consumer, provider, or neither. And question number 9. I receive IHSS support from, check all that apply: relative who lives with me, non-relative who lives with me, relative who doesn't live with me, non-relative who doesn't live with me. Question number 10. I look for providers via the IHSS provider registry and am successful most of the time when I use it, rarely when I've used it, never when I've used it. I haven't ever tried to use my county's IHSS provider registry. Question number 11. Where do you look for providers? And that's a text box. Question number 12. I have tried to access the backup IHSS provider system in my county. And then this is a multiple choice. I have not tried to use the backup IHSS service. I have tried to access the backup IHSS service with success. I have tried to access the backup IHSS service with some success. And I have tried to access the backup IHSS service, but it wasn't successful. Question number 13. Please explain your response here. Question number 14. I needed backup providers since the beginning of the COVID-19 pandemic. Yes or no? And then next we have the first of our 2 ranked choice voting questions. This first one is, what do you see as being the top issues or challenges facing IHSS consumers? Rank from 1 to 6, with 1 being the most important and 6 being the least important. There is a shortage of workers / it is difficult to attract and retain workers. Next option is providers want and need higher wages. Next option is there is not a backup provider system in place in most counties, and or it is not easy to access or navigate. Next option is the way hours are assessed do not account for the length of time of tasks or take all of the tasks that are needed, or all of the tasks that are needed. Next option is lack of consumer representation in the public authorities. The next option is the introduction of electronic visit verification, or EVV, implementation that requires geo or GPS tracked timesheets. And then finally, there is one for other. And then the next question is, if you checked other, please list the issue here. Next question is, please rank from 1 to 13, with 1 being your highest priority and 13 being the lowest, the improvements to IHSS you think are most needed or most important. First, there should be a major campaign to recruit more providers. Next, IHSS providers should be paid at least $20 an hour. Next, there should be higher wages for providers supporting people with a high level of hours, 196 hours and greater. Next option is IHSS providers should receive paid vacation time, more paid sick leave, and healthcare benefits. Next option is the state should pay for IHSS providers' fingerprinting. Next option is IHSS providers should be paid for a certain amount of hours of training by their consumers. Next option is IHSS providers should continue to be paid for providing services to their clients when they are in the hospital. Next option is there should be an accessible and easy way to navigate working backup provider systems for when a provider is not available. Next option is there should be a more realistic hours assessment that accounts for how long tasks actually take. For example, doing laundry. Next option, create a simpler provider enrollment process. Next option, in general, revamp the philosophy of IHSS so that it's about a person's own goals, similar to the Developmental Services Self-Determination Program approach, and supports a person's thriving. Finally, make all IHSS public authorities independent agencies, not part of the counties, so they can help negotiate between the county, providers, and consumers. Question number 18, are there any other solutions or improvements you'd like to see that are not listed above? Another way to think of this is if you could wave a magic wand and make 1 or 2 improvements to the IHSS, what would those be? Number 19. Also, what supports and services do you think need to be covered by IHSS that are currently not? And number 20, can we follow up with you later? If so, please complete your contact info above. And number 21, what sort of supports or accommodations would you need to participate? For example, American Sign Language interpretation, closed captioning, revoicing, language interpretation, documents in accessible formats, or any other accessible needs. And then thank you for completing our survey. And I see that there are a number of questions in the chat, so I'm going to take a moment to break and go into kind of a Q&A. At this point, we can kind of open it up to general questions about any part of this process and the survey.
This is Megan. Russell, would you like me to read out what's been in the chat?
Yes, please.
Great. So the first question is, will this survey be available in languages besides English and Spanish?
So as of right now, this is what we currently have capacity for. However, if partners and others, if we look at partnering correctly with others that might be willing to translate it for us or assist us with finding means of translation, I think our group would be open to that.
Thank you. And there's a comment from Ingracia. She says, can you change Latino to Latinx on the survey?
So that is a question maybe for the leaders that we have here with us. That language is not a part of the survey that was personally brought by the DOnetwork. So perhaps maybe a hand-in-hand leader might be able to talk about pros and cons of changing that. I believe that that's something that certainly could be, it can be changed.
I'm agreeable to it. I think we just didn't catch it.
Yeah, I think that we could change that pretty easily. I also think on that particular question, it would be good if we, instead of pick one, pick as many that apply in terms of like ethnicity.
Okay.
Yeah, should be a pretty straightforward, easy change.
I agree.
Awesome. That's why we have this, so we can get this great feedback. We have a question here that says, will there be a link to a recording of this meeting sent out? And yes, we are recording this. It's being live streamed on YouTube, so we'll have an archive available very shortly after today's webinar. And then we have a comment from Sheila asking if we should explain ranking to folks.
Explain ranking to folks. So the ranking, go to one of the ranking questions. So here's the first ranking question. What do you see as being the top issues and challenges facing IHSS consumers? Ranked from 1 to 6, with 1 being the most important and 6 being the least important. So I can go here and choose an option. And I actually need to modify that because with other, it's actually 7 options. So you can change this one to be rank number 3, I believe. Yes. So see, you can move them or you can actually drag them as well if that works better for you.
Thank you, Russell. Hopefully that will help folks take the survey more easily. Yes. We do have a hand up. I'm going to read a few more questions or comments from the chat, and then we'll come to the raised hand. Great. Trish says, please, 1, what is the backup IHSS service? And 2, will there be need to note when there has been a survey completion assistance?
Will there be? Oh, thank you. Thank you, Trish. That is actually a note that does need to actually be added for assistance with survey. Thank you.
Great. And then I think Trisha's first question is, what is the backup IHSS service?
So backup IHSS services are programs that counties develop to provide a care provider whenever there is not a provider available. During COVID, the counties the IHSS programs are required to develop systems to help recipients or consumers receive a provider even when there is not a provider available. So if someone were to call out sick, the consumer could call in and get a backup provider. And some of these programs are certainly more developed than others. And that's something I think we're trying to capture.
Thank you. And our staff Cameron shared in the chat the YouTube link where you can view former archives from the DOnetwork and where you'll be able to see this meeting once it has been archived. And I'm going to come now to Yael with your hand raised. Please go ahead. And it looks like you actually just muted yourself, Yael.
So I have a couple of questions. My question is about the question about the registry. I'm not quite sure. I mean, I'm not sure if I would have really known how to answer that question, because if someone, for instance, got referrals from the registry and but was unable to hire somebody from that list, is that a success? Is that success from the registry's point of view? In other words, I think there might be a little, I don't know if it can be fleshed out a little more, because since registries give referrals and not necessarily have the power to change the outcome. So I'm just wondering what your thoughts are about that. Also, well, actually, I'll just leave it at that for now because I can't remember my next question.
Actually, I think that, this is Sheila, I think that a good question would be, how is success defined for a registry?
Yeah.
But in the case of, like, how would you answer that? My response to you would be, did you feel that working with a registry was successful? Yes or no? Whatever your definition is. And perhaps if you wanted to help us by defining it, you could write it in one of the open question boxes, because that's data that should be taken.
Fair enough. And then the other question I had was, is it possible to put with the consumer or provider, either also include past consumer, past provider, or potential consumer and potential provider?
What do folks generally think about that idea?
I would be okay with past provider or consumer, but as I see it, anyone is a potential consumer or provider. So I guess anyone can take this survey. Yeah.
And this is Megan. I was just going to read the comment. Trish says, thank you, Ingracia. I do not believe we have such a thing here in Del Norte. I'll look into it.
Thank you. I also saw a question about question number 13. Is that correct, Cindy? Cindy, if you're still with us, feel free to respond.
This is Megan. I apologize. I have to give Cindy the option to talk. There we go.
Okay.
Cindy, you should be unmuted now. Perfect.
Okay, thanks. Yeah, I just got confused. What is that referring to? Question number 12? Or should those two, 12 and 13, be combined or what?
So unfortunately, it won't allow us to actually combine them. But Yes,
what
it was meant to
the-
follow question 12.
Okay. Okay, yeah, okay, thank you.
Thank you. All right, so are there any other questions? I definitely appreciate the feedback from all of you here, which is why we need to do more of this intentional organizing. And I just wanted to thank all of our panelists and our support staff today. Thank you for all of this. This is our first time doing a big interactive webinar. So we're learning a bit as we go with the technical features of Zoom versus having an interactive experience. So I'd really love to hear maybe what your experience in this webinar was. We have a survey that will be popping up in a box with a link as you exit the Zoom today. And we'd appreciate if you'd give us some feedback specifically about the experience in today's webinar. And I look forward to connecting with some of you who have provided feedback specifically. I think that it's really important that we continue to have these discussions and bring those of you that wish to provide input and be a part of this along with us the opportunity to do so. So I really look forward to this. Yeah.
I have something to add / a question. We were going to have breakout rooms, but we couldn't make it happen so that the captioner could be in each room. It wasn't possible. Would people like a breakout room set up if we could make that happen? I'd like that answer. Oh dear, did I scare the muggles?
No, I see an answer from Constance with 2 exclamation marks. She says yes. And then Hannah says, I think with the number of people on this call, it worked to keep in the large room. And Kelly also gave a yes with 2 exclamations. And one more comment, Emily says, if attendees are allowed to answer, yes, please, if time permits.
Well, I think there's room to do more of this. And so time will permit if we make time permit. So if breakouts are things that people want in order to create an organic space for this, we need to figure out how to make that happen. It may be that means that there is 1 captioner per room. I don't know how that works. I'm not a Zoom wizard, but it seems we have our work cut out for us.
So I've got an idea, and that's that we look toward maybe practicing for the model that we want to build in January, and some leaders coming together and having some ideas about how to facilitate smaller interactive meeting style Zoom meetings around IHSS and advocacy and organizing. So perhaps with the work ahead, what we can do is start training each other to become organizers and facilitators and look at building a structure that works. I do think that it's important that we strike the balance and making sure that things are well facilitated and smooth for everyone. So I appreciate that folks want that interactivity too. So thank you. Trish has asked, how many participants are there? There are currently at this moment in time 34 participants, including those of us that are interactively part of the panel.
I see that Yael has a hand up.
Thank you, Yael. You're unmuted. Please go ahead.
I just wanted to thank you for making this a much better experience as far as visually. I found it a lot more helpful, and I really, really appreciate you taking that into consideration. It helped me a lot.
Thank you. We appreciate that feedback. All right. So I'd like to give everyone just a final opportunity to say anything, any questions that they have about the survey, or maybe maybe a word or two about how folks are excited to get the survey out. I'd recommend, please, given that there were some modification requests, please give us until the end of the day today to make those modifications, and then start preparing your strategy for sending them out. And we will be communicating with all of you via email, so there will be communication, and we will be talking about how we're doing as we move along as well.
Remember your social networks when you're thinking about this activism. I'm not much of a social networker, but I have a suggestion for a hashtag, which might be good home care for all, or something like that. We can work on it. Anyway, I think that that's going to be important, because I think that's going to reach out to people that may not be on email or phones or email lists or any of that.
I'd also like to briefly give Cameron Moore the opportunity to share, if he'd like, the opportunity to connect with us socially.
Yes, Facebook, Twitter, Instagram, I'll put those in the chat in 1 second. But please, if you do have time, take a moment, follow us, like us, and connect with us. We have all of our upcoming events, activities, and more. So I'll put those in the chat. Just give me about 30 seconds, please.
And this is Megan. I just shared in the chat the link to register for the next event in this series on October 20th.
Thank you. I'll also revoice in the chat. Trish has shared, I came to this through my supervisor, Alyssa Norman. I would be pleased if I could be added to the invite list. Trish Cantrell, Patricia at Tillenet from Tri-County Independent Living in the Del Norte County office. And absolutely, we've got all of your information as you've registered on for this event. So we look forward to continuing to engage you, and you will be hearing from us. Also, Cameron has shared, we have also been tweeting bits and pieces of today's Zoom conversation. Thank you so much for joining us. And in the chat now are the DOnetwork Facebook and Twitter links. Special thanks to our captioners, and again to Megan and our partners hand in hand, and all of you for being here with us today.
Thank you, Russell. This is Megan. I'm going to leave the webinar open for 1 minute past the hour for folks to save anything in the chat. Thank you for joining us today.
Thank you, everyone, for joining us today, and have a good afternoon.
Let's make sure that we capture the chat before it disappears ourselves. I mean, as an archive. Yeah.
The chat will automatically be archived as part of Zoom.
Okay. As part of the recording?
Yeah.
Okay, cool.
I think you did catch that correctly, Hannah. It looks like the link for Instagram is not our correct link. We apologize for that.
If folks have Cameron Moore's email and want to be tagged in any social networking setting, I guess we should let him know. I'm going to do the same. And I think I'm going to bounce. Have a good day, everybody.
This is Megan. I just shared Cameron's email in the chat, and he just shared the proper Instagram link. So thank you for catching that, Hannah. We do no longer have captions since we're at the hour, so we won't be providing any more verbal content, but we're leaving this open for one more moment for folks to save anything from the chat. Okay, it looks like we're down to not many attendees.